Hi, Lucky. We are so happy to have you with us today. Thank you for making the time.
Thank you for having me.
Um, well, I would love to start with you just sharing a little bit about yourself and what you specialize in for the Nyssa community that haven't heard about you yet.
Perfect. So I'm Dr. Lucky Sehkon. I'm a reproductive endocrinologist and infertility expert. I'm also an OB-GYN, so I'm double board certified. And I practice based in New York City at a large fertility center called RMA of New York. And what I'm passionate about is educating and empowering women about how their bodies work, about their reproductive system, and about their family building options and fertility preservation options. So that's my primary area of focus in terms of my practice. I do spend quite a bit of time on social media and in the press trying to do the same. Really, my mission is to just empower and educate. So thank you for having me on and sharing this with all of your followers and your base, because I think it's so important to bring up these conversations.
We will just get.
Sounds good.
Somebody has said periods should always last a week.
Yeah, so anytime someone says should always when it comes to nature and biology, that's usually a myth. Because we're all built differently and all of us have a different uterus, a different lining, a different hormonal environment in our body. So there's no one size fits all. We talk about averages and what's typical. It is typical to have a 7-day period, but a lot of people have, 4 to 5 days of bleeding. Some people have a little bit longer than that. So there's always a range of normal. And then there's things that are a little bit more extreme, like bleeding for 2 weeks or longer, that is not a normal period length. And that might actually signal certain issues like fibroids or endometriosis. So it's always important to know that you don't have to be exactly by the textbook definition of, what's considered average. And I think that that's okay.
Yeah, and it's really what's normal for you, right? And then taking that deviates over time. Yeah.
And it could deviate in your own cycle. There could be intra-individual variation and inter-individual variation.
Right. Yeah. Yep. Great point. Okay, next one is tampons can get lost in the vagina.
I think that this is like a middle school fear that anyone who has ever used a tampon, it's definitely crossed their mind. But if you think about the anatomy of the reproductive tract, the vagina is not a bottomless pit, right? There is an end to it. It's not just like a canal, like a toilet paper roll either. It's more complicated than that. It is a canal, and then there's a cervix at the top. So it does end. And there are also these corners that we call fornix or fornices, if you are talking about more than one on each side. And it is possible that it's not lost, but it's possible that the string could get tucked up inside. So externally, you can't feel it. And not everyone is as comfortable with their body as the next person. So some people feel, scared to insert fingers inside to look for the string. I've had patients who have forgot that they had a tampon in and put another tampon in. So it really pushed it into the fornix.
Pretty much every one of my friends has done that at some point in their younger life in particular.
Exactly. And that could be a way to lose it, but you're never really losing it. If you search hard enough, you'll find it. But if it's really far into the corner, sometimes it's hard to access, and you might need to call your GYN's office and just ask them to do a quick speculum exam and retrieve it for you. I mean, that's happened before, but it's never lost, and you're never going to need like a surgery to retrieve it.
Yes. And that obviously applies to like menstrual cups as well, right?
Correct.
Okay, yes, thanks for clearing that up. And the next one is PMS is made up.
Definitely not. I mean, premenstrual syndrome is a constellation of symptoms and signs that tend to occur in the week leading up to your period. And as someone who deals with hormones and the effects that they have as part of their professional life, I can tell you that progesterone is a hell of a hormone, right? It has so many effects on different systems in our body. And so what's happening to get a period is you have to, and this is a period not induced by medication or going off of the birth control. This is a period from an ovulation cycle. What's happening is when you ovulate, you release tons of progesterone after the fact, and that lasts for a week to 2 weeks. And as those progesterone levels fall, that's when your lining starts to break down and you get a period. So a lot of those premenstrual symptoms are the result of the effects of progesterone, right? So feeling constipated makes sense because progesterone relaxes your bowels and it has a relaxing effect on your entire body. So feeling tired, demotivated, constipated, having mood symptoms, that withdrawal of the progesterone as it's dropping can definitely make you irritable, more prone to anxiety, depressive feelings and thoughts. This is a normal part of the hormonal variation during the menstrual cycle. Now, it's important that we normalize it, but also acknowledge that some people have such pervasive symptoms that could be so disruptive to their daily functioning that they might actually have a different entity, which is related but different, called PMDD, premenstrual dysphoric disorder, which is basically something that can be treated with medications. It doesn't have to be, it could also be treated with talk therapy. But my point is, if your PMS or what you think is PMS is so bad that it's disrupting your function, and that entire week your life is falling apart and you're spending the other 3 weeks of the month putting it back together, that's a sign that something might be wrong and you may need professional help.
Yeah, thank you. And for PMDD, is that something that you're hearing? Because, for me, just personally, just being a woman in this world, it's only something that I've really heard be talked about more in the last sort of, handful of years. Is within the sort of medical community, do you feel like there's a bit more kind of emphasis on understanding?
Acknowledgement.
Yeah.
Yeah, for sure. And I think that that is so great and so helpful because it's not that this is a made up disease or, something that just was invented or emerged only recently. People have been suffering with it for forever.
Yeah.
And I think they've a lot of times suffered in isolation or it's been stigmatized. And I think PMS gets a bad rap because, people weren't really recognizing PMDD as a separate entity. But now we know that antidepressants are the mainstay of treatment. Being on birth control or, forms of contraception that stop ovulation have also been a proposed treatment, although it probably is less effective, but I think that it's still effective. And then just therapy in general. So I think that it's important if it's really disruptive to get evaluated.
Yeah. Great, thank you. Okay, severe period pain is normal.
Sorry, say that again.
Severe period pain is normal.
No, I mean, pain is a sign that something is wrong. I think Madonna said that, right? But it's a pretty obvious statement. I think having some level of discomfort and cramps is normal when you think about the fact that the uterus doesn't like blood. And when the lining starts to break down, it's going to cramp to try to get rid of it, right? And if there's inflammation involved in that breakdown process, inflammation tends to cause swelling and pain. But again, similar vein to PMDD, things can be normal up until a point, but when they start to really disrupt your ability to function. So if you're missing work, you're missing school, you're spending the entire day in bed, maybe days on end in bed while you're on your period, those aren't normal. And if you're losing so much blood that you're feeling weak and you're becoming severely anemic, that's not normal. So I think, severe cramps, yes, there are treatments for it. It's normal to have cramping, but if it's not relieved with over-the-counter Tylenol, Motrin, and whatever your doctors are recommending, then they may need to step in and think about other ways to treat it beyond just over-the-counter painkillers.
Yeah. Okay. Menstrual cups are one size fits all.
No, I mean, just like our anatomy isn't one size fits all. We can't all just go to the store and buy the same size and length of jeans, right? So obviously our bodies come in different shapes and sizes, and the same person throughout the course of their life may need different sizes because your vaginal canal and your reproductive tract change after having children. So don't be surprised if after having a vaginal delivery, you need a larger menstrual cup. I mean, that's all part of the shift and change and the dynamic nature of pregnancy and delivery.
Yeah. Okay, you can't get pregnant while you're on your period.
I mean, it's not the most common thing to happen, but for people, especially with irregular cycles where your period's all over the place, you could, because especially if you tend to have a really long period, that's just how long it takes for your lining to break down. But that's a separate process than what's happening in your ovaries. And it's possible to have dysregulated cycles where you're ovulating at unexpected times. So we know that the rhythm method, where you're just using your period as a marker of when to avoid sex, unprotected sex, and when to be trying, if you're trying to conceive on purpose,
Mhm.
isn't the end all be it all, right? And I think it's important to know if you're using the rhythm method and you're having sex close to the time of your period or during your period, thinking that it's a foolproof method of contraception, that there's actually quite a high failure rate, and you should definitely have a backup plan.
Yeah.
And you can still catch STIs if you have sex on your period as well. I'll just throw that in there. So
Yeah.
it's
No,
important to
good
be
to,
aware.
yeah. Yes. Good to know. Okay. Having a regular period is necessary for your health.
I wouldn't say having a regular period is necessary for your health, but if you have an irregular period, I do think it's important to not just chalk it up to this is who I am. You should have a really thorough evaluation and workup, because it can be a sign of other things like having thyroid disease, having under or over functioning of your thyroid gland, having high levels of a hormone called prolactin, which can come from a benign tumor in the pituitary gland, which is actually not as rare as people might think.
Mhm.
And that's something that could be treated medically, but in rare cases, it might need surgery. So these are things that you want to know about. You could have an underlying issue called polycystic ovary syndrome, which is really common. It affects up to 10% of the population, and it's not your fault. It's not because of lack of exercise or dietary issues. Those lifestyle changes can definitely aggravate it as a condition and make your cycles more irregular. But a lot of it is just our genetic makeup and something that is unavoidable. And it isn't just something that matters for when you're trying to conceive. It is linked to other seemingly unrelated issues like metabolism and chronic health conditions. Women with polycystic ovary syndrome have an increased tendency towards issues like obesity, type 2 diabetes later, especially later in life, hypertension or high blood pressure, cholesterol issues. And these are all chronic health conditions that can impact, your lifespan and your quality of life and other medical problems. So I do think it can be normal for you to not have a 28-day clockwork like cycle. There's always variation, which is normal. And I think if you have an irregular cycle, it is important to understand why. And then it's not something I would necessarily worry about. I would say one additional thing about PCOS is not having cycles for months on end is never normal. And if it's because of PCOS, that's another reason to look into this, is that lack of ovulation leading to lack of a cycle can lead to an unhealthy buildup of your uterine lining. And that unopposed estrogen, it's unopposed because it's not balanced out by the progesterone of ovulation, can over time, in some individuals, lead to a transformation of their uterine lining into precancer or cancerous cells. So uterine cancer in young patients oftentimes happens in the setting of diseases like PCOS, which have remained unchecked. So what's the solution? If you're that patient who has irregular cycles or never gets a period, and we know it's because of PCOS,
Mhm.
we can induce you to shed your lining at least every 90 days to protect you from things like this. So don't ignore it. See a doctor if you're not getting answers as to why your cycles are irregular. See a reproductive endocrinologist like myself. Get the answers.
That's really helpful. I think a lot of people don't necessarily know that. So yeah, thank you for sharing that. And that kind of leads to this next statement that we've had, that having a regular period means you're fertile.
So it doesn't, because infertility can arise from so many different mechanisms, right? What does it take to get pregnant? Well, you have to have an egg that's released, that's ovulation. So if you're ovulating regularly, that does help, because at least you're in the game on a regular basis. When you ovulate, that egg only survives for 12 to 24 hours. So it is helpful to know when you're ovulating. And if it's regular, it's easier to time it out. so that you get sperm into the reproductive tract 2 to 3 days before you actually ovulate. So it is helpful to be someone that ovulates regularly and has regular periods. And the best sign that you're ovulating regularly is the regularity of your menstrual cycle. So definitely, use one of those free apps that you can download and just keep track of when you get the first day of your menstrual period. And that'll be the best clue as to when you're ovulating. And, I would say, it's not the end of the story though, because, the sperm and the egg can't meet in the tube if the tubes are blocked. And sometimes you'll have no idea that the tubes could be blocked. So if you've been trying for 6 months to a year and it isn't happening, or you're worried about it, even if it's not been 6 months, you can always go get a reproductive checkup and talk about ways to test for things like that. You could have fibroids inside the uterus, scar tissue inside the uterus that could prevent an embryo from implanting. So even if you have a regular period, there might be issues down the line after the sperm and the egg have met and turned into an embryo that prevent the embryo from implanting successfully. And also age plays a huge role, right? As we get older, our tendency to ovulate a genetically abnormal egg increases. And so sometimes that can lead to egg and embryo quality issues that can lead to infertility and recurrent miscarriages. So there are so many different reasons why infertility takes place. And I didn't even touch, the issue of a male partner with sperm, because obviously 40% of infertility is related to the male side of things. So it's important to get a full evaluation and to not be overly reassured by having a regular period. But if you do have a regular period or a period at all, it's important to track it so that you can understand when to try.
Yes, yeah, and I think you make a great point that I think we're just sort of told like, oh, after a year then you can go and see a doctor.
Yeah.
But truly, I mean, especially if you are a bit older as well, like go earlier if you have
Yes.
concerns and get
And
checked.
at least here in the States, you don't actually need a referral,
Right.
right? So sometimes people get resistance from their OB-GYN, and these are my colleagues. I know and I love them. And
Mhm.
sometimes they'll just be a little bit laid back and say things like, you know what, you should just keep trying and come back to me in half a year. But if there's a little voice in your head that's saying, I want to be evaluated, I'm concerned, I'm anxious, maybe it's something in your family history, maybe it's something you were told by your gynecologist growing up that you might have difficulty and you don't really understand why they said that. Whatever the reason is, if that little voice is in your head, just go get an evaluation,
Yes.
right? Coming to see someone like me doesn't mean you're going to be signed up for treatments. It means we're going to do a thorough evaluation and try to understand everything we can about your reproductive system so that we don't end up wasting time.
Yeah, that is great advice. Okay, so last one in this like myth busting section. People's periods will sync up if they spend enough time together.
I fell for this myth when I was growing up because I have sisters. I thought it was totally true. I would say like, don't use my towel because like you're on your period and I don't want to get mine. So the idea came from a really old study where they demonstrated that a certain group of women tended to have cycles around the same time, and it was attributed to this theory of pheromones. That pheromones are these chemicals that can be transferred from one individual to the next, especially if they're, sweating or it's coming from certain glands, and that it could cause your hormones to sync up and therefore your periods to sync up. But a recent study, well, I wouldn't say it's that recent, but a big study in the Nature journal, which is a highly reputable medical journal, and many other studies have debunked this myth and said it's really just up to chance. If you live with someone for a year, it's just inevitable statistically that there are going to be periods of months where your cycles sync up. But it's not a real biologic phenomenon, and that's not how our hormones work. So it's a cool idea. And there's also some really interesting social theories that, from an evolution standpoint, it was a way for women to band together and prevent a male from becoming reproductively dominant. So if they all sync up their cycles, they're all fertile at the exact same time. So you can't possibly, impregnate all of them at the same time, which is
Right.
kind of interesting.
Yeah.
But there's no truth to it, even though it's a nice idea.
Yeah, no, yeah, I do like that idea. But okay, that's good to know.